that's it, and blow out. Take a deep breath in, push up, way up, that's what I want, and blow out.
This activity is primarily accomplished by the serratus muscle. Lower-level quadriplegic patients are generally very successful at performing posterior chest expansion utilizing this movement. The final group of techniques used to alter breathing patterns involves decreasing or varying the patient's ventilatory rate. A high ventilatory rate is often due to paralysis or spasticity, restricting chest wall compliance, which chronically lowers tidal volume and increases the patient's work of breathing. Therefore, the goal is twofold. First, to help the patient decrease his rate of breathing, and second, to simultaneously increase his resting tidal volume. We will now demonstrate the two techniques in this final group aimed at assisting the patient to better control of his ventilation. These are the counter-rotation maneuver and the previously demonstrated butterfly maneuver.
You have a high respiratory rate. Can you feel how quickly you're breathing down here? I'm going to do a little work with you on this and try to help you to relax so that your breathing can be slowed down. I'm going to breathe with you so you can hear how fast you're breathing.
The counter-rotation maneuver achieves these two goals of decreasing breathing rate and increasing tidal volume by using assisted trunk counter-rotation to increase tidal volume capacity on inspiration during the trunk extension phase, and by promoting greater expiratory volume and flow rates during the trunk flexion or compression phase. Timing of flexion and extension is initially determined by the patient's rate of respiration. Initially, small increments of trunk movement are progressively increased. As the patient's tone is relaxed and increased tidal volumes are promoted, the therapist gradually slows the rate of trunk rotation. The patient can usually adapt to this new respiratory rate if the therapist closely coordinates her increasing control over the patient's breathing pattern. A similar outcome can be achieved by using the previously demonstrated butterfly maneuver. We've just presented a group of techniques aimed at this second component of a ventilatory rehabilitation program, techniques to alter breathing patterns. The ultimate goal in this group is to achieve both efficiency of breathing and integration of an altered breathing pattern into functional activities, such as coughing and ADL skills. Next, we'd like to present the third component of a ventilatory rehabilitation program, assisted cough techniques. This component addresses two of our 7 goals: to improve cough effectiveness and to increase the patient's and/or family's ability to maintain good bronchial hygiene. The ability to maintain a clear airway is one of the most critical aspects of ventilatory management. In teaching a patient how to produce an effective cough maneuver, it's advisable to first address the initial 2 components of a respiratory program: positional considerations and altering breathing patterns. These then sequentially lead toward attainment of success at one or more of the assisted cough techniques. In this next segment, 12 assistive cough techniques will be briefly demonstrated in 5 developmental postures. The costophrenic assist aids in lower chest compression during the expulsive phase of a cough. This technique is demonstrated here in supine and will be shown later in side lying.
I'm going to put my hands down on the lower borders of your rib cage, and let me explain to you what you'll do. First, you'll take an easy breath in and out. At the end of that breath, I'm going to facilitate a deeper breath for you. Then I want you to hold that air. When I tell you to cough, I want you to look slightly over this way, so you're coughing out in that direction. And I want you to give me more than 1 cough if you feel the need, because you're going to have a lot of air build up back there that I can help to press out. And that's what you have trouble doing, is getting the air out. So if you want to give me 2 or 3 coughs with 1 breath, that would be good. Okay?
Okay.
Okay. So first, an easy breath in and blow it out. And take a deep breath in, real deep, hold it, and cough. Okay, let's do it one more time. This time I'd like you to give me 3 coughs because I still felt some air in your lungs.
Okay.
Okay, easy breath in and blow it out. Take a deep breath in, real deep, real nice, and cough. Good.
The anterior chest assist aids in compression of both the upper and lower chest during cough.
Dana, the next assistive cough we're going to do involves your upper and lower chest. It's going to be the same sequence as before. I'll ask you to take an easy breath in. I'll help get the air out. I'll ask you to take a deep breath in, and I'll facilitate a deeper breath. Then I want you to hold it, look slightly off to the side, and cough out, giving me more than 1 cough if you feel the need to do so.
Okay.
All right. Easy breath in and blow it out. Take a deep breath in, real deep, hold it, and cough. All right, let's try that again. Easy breath in, blow it out. Real good. Take a deep breath in, real deep, that's it, hold it, and cough.
A third assistive cough technique performed in supine, the Heimlich type assist, sometimes called the abdominal thrust, aids in inferior compression of the chest.
Cough is going to help you with your lower chest compression. I'll ask you to do the same sequence. Take an easy breath in, then take a deep breath in. I can't help you take that breath, so you have to take a deep breath in on your own, hold it, and then cough. Easy breath in, blow it out. Take a deep breath in, hold it, and cough. Let's do the same thing again. Easy breath, blow it out. Deep breath in, real deep, hold it, and cough.
When performed as shown here in supine, it may be uncomfortable for the patient. In supine, this Heimlich type assist maneuver may also elicit a spastic response from the abdominal muscles, which would most likely render this technique ineffective. Another way to perform the Heimlich type assist is in a side-lying position. Moving the patient into side-lying allows the patient's hip and knees to be flexed into reflex-inhibiting postures, thereby decreasing the risk of muscle spasms interfering with this maneuver. However, it is more difficult for therapists to stabilize the trunk in this position.
Dana, can you bring your arm in front of you there so that you can use your upper chest muscles from that position? We're going to try the same assistive cough here in sideline. Can you give me an easy breath first and blow it out? Now take a deep breath in, hold it, and cough. It was nice. Let's do one more though. Easy breath in and out. Deep breath in, hold it, and cough. Fine.
The costophrenic assist was previously demonstrated in supine. Here in side-lying, the maneuver becomes particularly useful for patients with asymmetrical weakness or specific lung segment pathology.
Dana, we did this assistive cough in supine. We're going to do it here in side-lying. I'm going to have you work up against gravity. I want you to try to take a deep breath into my hands and bring it up against gravity. All right?
Mm-hmm.
Take an easy breath in. Blow it out. Now take a deep breath in, real deep, hold it, and cough. Good. Let's do it one more time. Give me more than 1 cough if you can. Easy breath in, blow it out. Breathe into my hand, breathe in, hold it, and cough. That was better.
Combining the costophrenic and Heimlich type assists in side-lying brings into play more planes of ventilation, resulting in a more effective cough than with either technique performed alone. A limitation of this technique is that it may be difficult to coordinate with a patient's breathing pattern and subsequently difficult to teach a family member.
Dana, this time I'm going to combine the two previous techniques and see if I can help get the air out a little bit more effectively for you.
Okay.
Take an easy breath in and blow it out. And take a deep breath in, real deep, hold it, and cough. That was a much better cough for you. Let's try that one more time. Easy breath in, blow it out. Take a deep breath in, real deep, hold it, and cough. I like that one better for you.
Counter-rotation while side-lying is the only one of these 12 assisted cough techniques that incorporates all three planes of ventilation. Clinically, this technique is found to be very effective for assisting the patient in producing an effective cough.
This last side-lying assistive cough is going to help you in both your upper and lower chest at the same time. It'll help you take a deeper breath in before the cough and then help your chest compress more during the cough. What I'd like you to do is to take a deep breath in when I stretch your chest in this direction. Then I'll ask you to hold it. And I want you just to feel the air rush out while I compress your chest, so you feel what it feels like. Let's start with the easy breath. Blow it out. Now take a deep breath in. Real deep, hold it. Good. Now let's do it with a cough. Same exact sequence. Easy breath in. Blow it out. Deep breath in. Real deep, hold it, and cough. At a real nice volume. Let's do it one more time. Let yourself cough more than once if you feel the need.
Okay.
Easy breath in. Blow it out. Deep breath in. Real deep, hold it, and cough. Much longer flow rate. That was nice.
Due to the rotary component of this maneuver, all spinal precautions must be lifted. A common theme is seen with these final 5 procedures. Inhalation is facilitated with trunk extension, and exhalation is facilitated with trunk flexion. The head flexion assist primarily aids in upper chest clearance.
Dana, because you can get to prone on elbows independently, you might find this type of an assisted cough to be effective, particularly when you're lying in bed. And if supine is uncomfortable, you can use this. On prone on elbows, you begin with your head down and take a deep breath in as you lift your head. Hold it and cough as you throw your head down. Can you try that for me?
Sure.
That's it. Try it one more time. Take a deeper breath as you come up. Second one was better.
By locking the upper